Hi, I'm Dr. Jeannine Parikh with AIM Wellness, Medical Spa, and Dr. J Wellness. If you've entered menopause or are wondering what to expect, you've probably noticed changes in your mood, your body, and even your energy. In today's episode, we're diving into menopause mastery, what happens to your hormones, how they affect your brain, bones, heart, and weight, and what you can do naturally with bioidentical hormone therapy to feel like yourself again. So what is menopause? Menopause is defined as 12 months without a menstrual cycle. The average age is 51, though symptoms can start years before and last for a decade or longer. When the ovaries stop producing estrogen, progesterone, and testosterone, your whole body feels the shift. These hormones are not just about reproduction. They protect your brain, heart, muscles, and bones. So what is the role of estradiol? Estradiol is the strongest form of estrogen, is one of the most protective hormones in the body. It can help with brain and mood because estradiol supports serotonin and dopamine, which can help reduce anxiety, depression, and even brain fog. It can also help sleep. It calms hot flashes and night sweats that interrupt rest. It can protect bones and muscles because estradiol prevents bone loss and helps maintain lean muscle mass. And even your heart. It improves blood vessel flexibility and protects against cardiovascular diseases. And inflammation. Estradiol is a potent anti-inflammatory, reducing cytokines that drive joint pain, protecting brain cells from neuroinflammation, and supporting immune balance. And here's something important. When it comes to hot flashes and night sweats, the most common and disruptive menopause symptoms, estradiol hormone replacement therapy remains the most effective FDA-approved treatment. It doesn't just reduce vasomotor symptoms, it improves sleep, mood, and quality of life. Major medical societies, including the North American Menopause Society, or NAMS, recommend estradiol as first-line therapy for women, for healthy women, within 10 years of menopause. No other treatment, natural or pharmaceutical, has the same level of effectiveness. So for women who are candidates, estradiol is still the gold standard. So what about testosterone in menopause? We don't often talk about it, but testosterone matters for women too. In menopause, testosterone levels fall, leading to low libido, fatigue, irritability, and muscle loss. That's why bioidentical testosterone pellets are often life-changing. They can help you improve sexual desire and orgasms, restore energy, motivation, and mood, support muscle strength and metabolism. And emerging evidence even suggests that breast cancer survivors may benefit from testosterone bioidentical pellet therapy because this can help reduce recurrence rates and improve quality of life when monitored carefully. So many women ask, why am I gaining belly fat without changing how I eat or exercise? The truth is, it's not your fault. Menopause changes the hormones that control your appetite, metabolism, and muscle mass. So here's exactly what happens. So we have appetite hormone changes. So estradiol normally helps to regulate hunger and fullness signals. It keeps ghrelin, which is our hunger hormone, lower and makes your brain more sensitive to leptin. Leptin is the I'm full hormone. And when estrogen drops in menopause, ghrelin raises and leptin sensitivity falls. This means you feel hungrier, crave more carbs and sugar, and it's harder to feel satisfied after meals. Then we have muscle mass declines. So both estrogen and testosterone support muscle protein synthesis. And when these hormones fall, you lose lean muscle tissue much faster, and muscle is your metabolic engine. The more you have, the more calories you burn at rest. So less muscle equals a slower metabolism, means an easier weight gain, especially around the midsection. And insulin resistance increases because lower estrogen and testosterone makes your body less sensitive to insulin. This leads to more fat storage, especially belly fat, and a higher risk of blood sugar swings. So if you feel like your body has changed overnight, you're right. But it's biology, not a lack of discipline. The good news is with the right strategies like strength training, time-restricted eating, and targeted hormone or non-hormone therapies, you can fight back against these changes and reset your metabolism. The solution isn't eating less, it's eating smarter and moving with intention. So strength training is the menopause superpower. The most important exercise in menopause is strength training because it helps with bone health. Lifting weights stimulates bones to stay strong, reducing osteoporosis risk. Muscle and metabolism, so the more muscle, the higher the metabolism, even at rest. And hormone regulation, because exercise can help improve insulin sensitivity, lower cortisol, and this can help reduce belly fat and stress. And women report feeling stronger, clearer, and more empowered because their confidence and energy is better when they have more muscle. So even 2 to 3 sessions a week can transform your body, your bones, and your hormones. Another powerful tool is time-restricted eating or intermittent fasting. By shortening your eating window to 10 hours a day, you allow insulin to drop, which improves fat burning and stabilizes hormones. Example, you would start your breakfast at 8 a.m. and finish dinner by 6 p.m. And studies show that time-restricted eating improves metabolism, blood sugar control, and circadian rhythms, which are often disrupted after menopause. So not every woman can or wants to use hormone therapy. So for those women, there are effective medical options, including things like SSRIs and SNRIs like paroxetine, venlafaxine, and Lexapro. These reduce hot flashes, night sweats, and improve mood for some women. We also have a medication, it's a new FDA-approved non-hormonal option called Veozah, and that helps to block brain pathways driving the hot flashes. And these options don't protect bone or metabolism like estradiol and testosterone do, but they can significantly reduce symptoms. And beyond medications, there are some integrative supports that make a huge difference. So lifestyle changes, sleeping in a cool room, reducing alcohol and caffeine, and managing your stress. With nutrition, you want to look at more high protein, fiber-rich meals, high omega-3s, and phytoestrogen foods like soybeans, tofu, tempeh, flax seeds, sesame seeds, berries, dried fruits like dates or prunes, and even garlic. These can all help. And then there's botanicals that we recommend, black cohosh, which can help with hot flashes. That usually does take 6 to 8 weeks to see any improvements or changes. We have ashwagandha, which is very useful for stress and sleep. And then maca and ginseng, which these help to improve libido and energy and mental clarity. And then pycnogenol for vascular and hot flash reliefs. So as we wrap up today, I want to leave you with this. For too long, women have been told to just live with it, to suffer through hot flashes, weight gain, poor sleep, or low libido, because it's just part of aging. Many women avoid hormone therapy out of fear of side effects, fear of risks, fear from outdated studies that don't reflect today's science. But here's the truth. When prescribed responsibly and monitored correctly, bioidentical hormone therapy is safe, effective, and life-changing. It's not about vanity, it's about protecting your bones and your brain, your heart, your metabolism, and your quality of life. Yes, every medical treatment comes with considerations, but decisions should be made from a place of education and not fear. The research shows us that the benefits of restoring balance with hormones far outweighs the risk for most women, especially those in early menopause. And you deserve to feel vibrant, confident, and strong, not just to survive this transition, but to thrive in it. So don't be scared, be empowered. Ask questions, get informed, and find a provider who listens to you and creates a personalized plan. Because menopause isn't the end, it's a new chapter. And with the right support and tools, you can be one of the healthiest and most fulfilling stages in your life. So download our Menopause Survival Guide, Hormones, Habits, and Hope, and book a comprehensive hormone consultation at AIM Wellness Medical Spa. And I'm Dr. Jeannine Parikh, and this is Hormone Truths with Dr. J, helping you create harmony in menopause and beyond. Thank you.